Hi, I'm Molly Milford. I'm going to be your nurse practitioner today. What brings you in?
Some ear pain.
Which ear is bothering you?
That right one.
Okay, so we have a 24-year-old Caucasian male who's here today for some ear pain. When did your ear pain start?
About a couple days ago, I woke up getting ready for the day and went and swam and worked out, and then went to work, had a normal day, and then I noticed it was kind of bothering me toward the end of the day, and then I woke up the next morning. It was really, really painful.
Where does it hurt?
Right on the inside of the ear, and then if I push right here on the outside, that'll cause pain too.
How long does your pain last for? Is it constant or does it come and go?
All day, constant.
Does anything make it better or worse?
When I stick a Q-tip in there to clean out my ear, that really causes a lot of pain.
Has anything made it better?
No, not that I noticed.
How do you describe the pain?
It's kind of a dull ache throughout the day, but like I said, when I go to put a Q-tip in there to clean my ear, it's like a sharp shooting.
Does the pain radiate anywhere?
No.
So you said it started, you got ready for the day, and then you went and swam, and that night it started to ache. When you got ready that day, did you clean your ears with a Q-tip?
I did.
How often do you clean your ears?
Once in the morning and then once at night before I go to bed.
Okay, so twice a day.
Mm-hmm.
Have you been around anyone lately that is sick?
Just at school, a lot of kids are getting sick.
Have you had any history of head or ear trauma?
No.
Have you had any difficulty with hearing?
No, but it seems like people on the right side, if they're talking to me or something, it sounds a little muffled.
How would you rate the severity of your pain?
It's about a 7 out of 10.
Okay, I'm gonna get a little health history from you. Do you take any medications or vitamins or supplements?
Nope.
Do you have any allergies?
No.
Have you had any surgeries or procedures done on your body or your ear or anything?
No.
Do you drink alcohol?
No.
Smoke tobacco?
Nope.
Or use any drugs?
Nope.
What activities do you participate in? Do you do anything that involves pressure changes, such as scuba diving, or do you travel on an airplane often?
No, I guess I just a lot of swimming.
Well,
every day.
And you said that you clean your ears twice a day, so that could cause a problem. Have you or a family member ever experienced this issue before?
No.
Do you or a family member have a history of diabetes or psoriasis?
No.
Okay, so I know that you said you have some muffled hearing and some ear pain. Have you had any ear ringing or tinnitus?
No.
What about vision or speech changes?
No.
Any fevers?
No.
Have you had a sore throat or sinus pain?
No.
What about nasal congestion?
Yeah.
Yeah, you've had that.
Mm-hmm.
About for how many days?
Just the last few days.
Last few days. Do you have any chest pain or palpitations?
No.
Any shortness of breath or cough?
No.
Have you had any nausea, vomiting, diarrhea?
Nope.
What about, have you had any recent falls lately, or have you noticed any changes in your gait or balance?
No.
So the nurse got your vitals earlier. Your temperature was 98.7, your rest rate was 16, your blood pressure was 110/70, and your oxygen was 99 on room air. So your vitals all look great. I'm going to go ahead and listen to your heart and lungs real quick. Normally I would listen underneath the clothing, but for the sake of the video and his privacy, I'm going to leave his clothes on. Alright, S1, S2 noted. Deep breath in. And out. And deep breath in. And out. Deep breath. Lung sounds are clear in all lobes bilaterally. Right now I'm going to palpate your sinuses. Tell me if you have any pain. Any pain?
No.
Okay, and I'm going to palpate your... No nodules are felt.
No.
I'm going to look in your mouth real quick. Use my tongue line. Can you open and say ah? Okay, great. So no oral lesions are noted. Oral mucosa is pink. No tonsillar swelling noted. And now I'm going to observe the nose. Okay. Okay. So nasal septum is midline. Nasal mucosa is pink. There was clear exudate noted. Now I'm going to look in your ears. So tell me if you feel any pain. Okay, great. I'm gonna palpate. Alright, no nodules felt, no tenderness when palpating or tugging the ear or touching the tragus. There was no discharge was noted, no foreign bodies. The ear canal was patent. Scant amount of cerumen noted. The tympanic membrane is gray with visible landmarks. Normal light reflex. No redness or swelling was noted to the canal. And so now I'm going to observe the right ear since this was the tender one. So please tell me if there's tenderness. Might I palpate?
Yeah.
What about behind the ear? No pain there?
No.
Okay. This might be a little tender.
Yeah.
Okay. So there was no nodules noted in this ear. There was clearly tenderness when tugging on the ear and touching the tragus. There was no pain behind the ear. There was some scant white discharge was noted. There was no foreign bodies. The ear canal was narrow, moist, and pale. There was some tenderness and redness. The tympanic membrane was gray with visible landmarks and normal light reflex. So now we're going to do the whisper test. If you can, I'm just going to say 3 words. If you can just repeat what I say.
Cat, dog, and house.
Okay, great. So you're able to hear what I said. Sounds were just muffled. So my 3 differentials for this exam is otitis externa, based on that the patient had pain with ear tugging. He's a frequent swimmer. He had exudate and swelling present, and he also has muffled hearing on that right side. Second, otitis media with perforation. He had unilateral ear pain, has some nasal congestion, and has been around sick people. Another differential is trauma. He frequently uses Q-tips, and he has ear pain, and a lot of the symptoms can resemble otitis externa. Thank you.